Hello, I'm Robert Schleip, and I'm very much looking forward to this conversation with David Sheehan. I'm a fascia researcher here in Munich, Germany, and I have been collaborating with Dave several times before, and this is going to be a very interesting conversation.
Clinical myotherapists combine fundamental health science knowledge with manual therapy, pain management and exercise therapy to help people recover from pain and injury, improving their physical function and quality of life. Its methods of physical and orthopaedic assessment share similarities with other allied health disciplines such as physiotherapy and osteopathy. Draw on 60 years of academic excellence and experience. This course is the longest established degree of its type and meets requirements for all leading professional myotherapy associations in Australia. Progress from a diploma to a bachelor's degree with many subjects now available for flexible online study.
I'm Jon Adams, Distinguished Professor of Public Health in the Faculty of Health, University Technology, Sydney. I'd just like to spend a few minutes just giving you an introduction to what my talk at the MMA Conference 2024 will be about, what it will introduce to you, and hopefully give you a bit of a taster that will excite you about coming along and listening more generally, and hopefully it can be very engaging as well and interactive as well as just me talking. But what I'd really like to do is just highlight what might the significance and importance of research be for health practice, and equally important from my perspective and many other people now, what might be the importance and significance of health practice and practitioners, in this case in massage and myotherapy, to the research endeavour or project itself. And I think obviously that it is an area which is traditionally seen as a place of disconnect and disjunction between what people in practice do in real life care and what research as a culture or a world looks like and focuses on. I'd like to break down the barriers between that disconnect and illustrate to you all at the conference some examples, some contemporary developments which I think are moving us ever closer to breaking down the gaps and providing ways in which not only can research be enriched by having a very close collaboration, input and co-design with people in health practice, the practitioners themselves, and of course, the populations they serve, but also to see what might be the benefits for health practitioners, for massage myotherapists in the community from engaging with research. And just to make one final point, thinking about some of the core features of the world and the culture of research, what I'd like to do is invite those of you in this field, in this area of professional practice, to consider your role individually in lots of different ways in how you may revisit or you may for the first time think about an engagement with research. This will not always entail and should not always entail a heavy involvement of time and resources. It is much more about a level of engagement that suits your current career, your current trajectory, your weekly time table, and ways in which we can build closer relationships between massage myotherapy and practice, and also a research base, including people like myself and other people in the academy. So I look forward to hopefully meeting you all later this year at the 2024 conference. And thank you again to the organisers and to the association for the invitation. I really look forward to meeting you all and having conversations. Best wishes until then. Thank you.
Hi everyone, I'm Stephen Walters. I'm excited to present at this year's conference. I'm looking forward to presenting you with the new way of understanding posture, the Upon method of postural yoga, and helping guide you and your clients to better mood, mind, and vitality. I look forward to seeing you at the Upon workshop.
Hi everyone, this is Dave Sheehan from The Connect Show. Extremely excited to have Robert Schleip all the way from Munich today. Robert is all things fascia research. Welcome, Robert.
Yes, I'm very much looking forward to that.
Now, I've been teaching in the cupping sphere, focusing in on fascia for a number of years, and I've constantly looked at what you've been doing from a research point of view to try and validate what I do with cups, and a lot of other people in their manual therapy practice. I know in Australia follow you as well to a great extent, and for a number of years. Now, you've just recently come out to Australia. You're at the World Congress on Lower Back and Pelvic Pain. Is that right? That was in December,
Yeah.
I think.
Yeah.
And also running some courses out here. You like coming out to Australia?
I used to come there regularly, so this was coming back after many years. Probably I haven't been there for 7-8 years. So last November, beginning of December, I attended the World Congress on Low Back and Pelvic Pain. That is a triennial congress, and I've been following it. So I had the privilege to run a whole plenary fascia session together with Carlos Deco. So that was very exciting. But previously, just a few days before, I did 2 workshops in Sydney and met some old friends. So that was really fun.
Yeah, fantastic. Robert, how are you keeping busy these days? Is it mainly at University? Is that right? Where you're teaching, or?
I'm now more at the Technical University in Munich. I'm still affiliated with the previous university in Ulm in southern Germany, but now our fascia research group is associated with 2 universities, but more with the #1 university in Germany in terms of academic reputation, with the Technical University of Munich.
Okay, and as far as fascia research and updates, I've noticed also close to the end of last year, you did do a webinar and you cited a number of things that are starting to change in terms of research and making fascia, even more. I remember you commenting on it being the Cinderella tissue, or the Cinderella
tissue. Yeah. So it was neglected as a mere wrapping, and now we recognize it is an essential player in nociception and proprioception, in sports-related pain syndromes, delayed onset muscle soreness, and many more features.
Yeah. Did you want to sort of unpack some of the, some of the latest research that's sort of changing the way people are thinking about fascia? Just a couple of points.
Well, that's already 2 years ago. Carlos Deco, who is a leading fascia researcher at the University of Padua in Italy, and we got together with a skin and haptic researcher because he had done a quantification of the nerve endings in the human skin. And he had found 100 million nerve endings in the human skin. And based on the complexity and the richness, he had argued that the skin should be upgraded to be a sensory organ and not just a tissue. So we got together with him and we did the same histological calculation for the human-wide or the body-wide fascial net. So that's not only the proper fascia that are enveloping muscles, but also, for example, the intramuscular connective tissue, and also the subcutaneous connective tissue that we call superficial fascia under the skin, that was excluded in the Terminologia Anatomica from their previous fascia definition. So with that wider definition of all the fascial tissues in the human body, we did a calculation together with Professor Grunwald, and we came to the conclusion that there are 250 million sensory nerve endings in the body-wide fascial net. And that makes it not our largest organ in the body. In a bodybuilder, the muscles have more mass than the fascia, but our richest sensory organ, richer than skin and even richer than the sense of seeing, which so far neurophysiologists had assumed would be our primary orientation in the world. In a dog, it would be smelling, but in Homo sapiens, if we are not blind, we had assumed that seeing is our primary and richest orientation, and that we use the other senses to support or modify that. But now we have to rewrite the whole human neurophysiology. We are primary feeling our own body in movement, a perceptual organism, and our fascial sensory stimulation is our primary orientation, and then the other senses can modify that.
Wow, that's a big leap from being taught the 5 senses of the body. Things have moved on. Hey, what about, Robert, what about the hyaluronic acid aspect of fascia as well? Because a lot of people, there's a lot of research that I'm seeing coming through to suggest that that substance in itself is an important substance from a densification point of view, and to allow, I guess, the maintenance of fascia and its relationship with other structures that it sits on and around.
Yeah, that was also propagated by a discovery of Carla Stecco. She found a new resident cell type called fasciacytes. They are not as spindle-shaped as the normal fibroblasts. They are more roundish, and they seem to be specialized on producing hyaluronan. And hyaluronan, depending on the environmental conditions, can be a slippery, water-like substance that reduces friction, but it can also be a very sticky glue. So the same substance depending on the pH of the environment. So in an acidic environment, hyaluronan can have a high viscosity, just like honey and ketchup at a very cold temperature. And that increases friction. So there's a lot of research now how mechanical stimulation, whether it's rolfing or cupping, can change not the amount of hyaluronan, but the aggregation condition of hyaluronan from a sticky condition into a more lubricating condition. And that is quite exciting. And now we have ultrasound imaging. For example, here is a portable one, so you can use that and look at the hyaluronan in between the two dense fascial layers surrounding the sternocleido. And you may see on one side of the sternocleido that you have more densified hyaluronan there. And that may explain the palpatory stiffness that you have. But maybe on the other side, you have a more fibrotic change, where you don't have a change in the hyaluronan, at least not in a visible manner, but you have more collagen type 1, just like in frozen shoulder or in Dupuytren contracture. So that is a very clinically relevant distinction that we can now do. I cannot do it by palpation, but with the ultrasound, we are able to find out, is it a densification in the ground substance due to a change in the binding condition of hyaluronan, and then you can change it in a few minutes by moderate to vigorous mechanical stimulation. Or is it a fibrotic change, and then you cannot change it in a few minutes? It will be a matter of several weeks.
And we've moved away from the term, I guess you could say, of saying we're breaking down adhesions. We're moving away from that, and it's more about reforming, would you say? Or how do you say that we approach...
So you can break down a sticky hyaluronan into a more lubricating hyaluronan. That is probably a mechanical breaking down. In terms of fibrotic adhesions, we know you can loosen them by regular myofascial stimulation. So that is the work of Geoff Bove and Susan Chappell. They have shown animals a regular 10-minute massage can not break down, but can lyse, can diminish adhesions, not in all of the rats where they did it, but in the majority of the rats, but only if the adhesions were fresh. They were not able to loosen them when the adhesions were several weeks old.
Yeah. Now that was presented. I was there at the Vancouver. Has anyone attempted to replicate that study?
Yeah, so they tried to replicate it with older adhesions, and they had zero success.
Yeah. So it's got to be fresh and new.
Yeah, so it needs to be fresh.
So you could say there's an argument for
their treatment protocol. So you cannot say it's impossible, but you can conclude from the research that we have so far, and more research is needed, obviously, but the research so far indicates that once the adhesions are older, it gets more difficult to loosen. Whether it's possible or impossible, that is too early.
Yeah. I mean, I love that that piece of research because, again, relating it back to cupping, we use negative or tensional pressure. And Susan was doing something pretty similar called skin rolling, right? So it actually created that tensional pressure as well, whereas most manual therapies are more compressive of nature or shearing of nature as well. So pretty fascinating. Hey, Robert,
also because of the previous research from Helen Lorgever, where she had shown that in chronic low back pain, you have an increased adhesiveness between two membranous layers of the lumbodorsal fascia. And then a master student in Germany, Annika Griefahn, I had the privilege to be an external supervisor for her. She showed simple foam rolling for a couple of minutes, not in low back pain patients, but in normal patients, would reduce the adhesiveness and increase the shear mobility.
There you go.
So if you can do that with foam rolling, where you press two layers together in a rolling manner, and then they slip more, which is kind of counterintuitive. If I have two membranous layers and I come with a compression on it, I would expect them to either not change or to be more adhere to each other. But her vertical foam rolling led to an increased shearing mobility. So you are not compressing, you are mostly lifting. So that makes it more likely that you would have a similar effect.
Exactly. Yeah. No, for sure. Hey, Robert, what's going on for you in 2024?
Well, at the moment we are having a very nice collaboration with the psychological department. So they used our stiffness measurement tool. Let me see, our Indento Pro that we had created, where you have a digital finger device. So instead of palpating and saying you are stiff on the upper trapezius, we have a digital finger. It indents, just like a pressing finger, into the upper trapezius up to a depth of 5 millimeters and measures the tissue resistance. And then you can find out whether it's stiff or soft and which side is stiffer. And they did that with a number of depressive patients and compared the stiffness in the upper trapezius, but also in the mid-thoracic erector spinae with healthy patients. And they found out that they were stiffer. But they had also less elastic recoil, and that is very unusual. Usually, if one and the same tissue is stiffer, it has more elastic recoil than a looser one. But they had a very unexpected increase in stiffness and still less recoil and more dampening. So we now think it may have a protective body armoring effect, or that it could be related to inflammatory edema-like changes. So that is very, very fascinating research. And now in a subsequent, so we have 3 studies following that. where in each study they have 100 depressive patients, and they are exploring how foam rolling, but also myofascial massage is changing them. In one study, they already showed simple foam rolling can have a significant change in the cortical expression of depression. So when you read them a list of words, and half of them are positive and then half of them are negative, and after a minute you read them a second list and ask them in each word of the second list, did you hear the word before? Depressive patients remember none of the positive words, but every negative word, even if it was only mentioned once before.
Wow.
So it means if you are a psychotherapist and you tell them wonderful things, they will not hear it, even if you stare at their eyes and touch them at the same time, etc., because of that filter. But if before telling them that life is not so bad or whatever, or look at this beautiful flower, they go on a foam rolling for 5 minutes, suddenly their cognitive filter is open for positive experiences.
Wow.
So and that test is used in pharmacology in order to decide whether they need to continue their pharmacological treatment or their behavioral therapy, because you need to continue until that filter is opening. And then it can switch to another therapy, to talking therapy or walking in nature or whatever. So the foam rolling had a profound shift in that cortical filter, but we need to find out what it is. So that is one of the research I'm now more involved. I love it because it shows that there is a very intimate link between the autonomic nervous system and a emotional stress response from the autonomic nervous system to fascial conditions.
To get a change in fascia itself from it. Yeah, that's amazing.
So that was also shown in a study by Siegfried Menze, but also by Caterina Feder in Padua, that from all the 250 million nerve endings, sensory nerve endings in fascia, the biggest contributor are not the muscle spindles, are not the proprioceptive ones, are not the temperature-sensitive ones. They are the sympathetic nerve endings belonging to the autonomic nervous system. They are the richest portion of the fascial innervation. So it means that there is a very rich, the autonomic nervous system has more grip on fascia than the somatic nervous system.
Interesting. Okay. So I guess we'll be seeing some research that comes out from a published point of view into some peer-reviewed journals on that.
Yeah.
Fantastic. Hey, Robert, we need to wind up, but it's been, as you use the term, fascinating. Chatting with you. It's been really great and lovely. And just to touch on a number of different things that are going on in the world of fascia as far as research is concerned. Hopefully we'll get to see you back out here in Australia. Our association would love to somehow tap into you coming out one day, I'm sure. You're very inspiring, not just to me, but to many of my colleagues back here in Australia. So it's amazing to see how much, I guess, how motivating you are to people to really, I guess, validate what they do in clinic, and how important it is to try and validate that through all the amazing work that you and other researchers are doing around the world in terms of just general manual therapies, but also in your case, specifically in the world of fascia. So thank you so much. Thank you very much. One last tip from me. If you want to learn about fascia and have as much fun as we have here in Munich, Germany, a very good trick is you try to take over some of the properties of fascia into your own personality. So you become a good networker. So you are not so much focused on defending mental property and fighting against other and competition. So you focus, just like you're doing, on collaboration. How can you learn from others? So a lot of people are doing that, and it works very well. You know, Robert, I've got to say, I'll just chip in there and say that the first fascia research congress that I went to, I was expecting the opposite, that people would be very protective, and you'd have the researchers on one side of the room and the clinicians on the other. But oh my God, it was such an amazing experience. And I guess that's a point that both you and I would make, is that if people can get to these research conferences, it's such a wonderful experience from a collaboration and networking point of view as well. So Fascia Research Society, we haven't touched on it all during our interview, but Fascia Research Society, if you guys at home are interested, is an amazing organization which is at the forefront, brings all the research together on fascia. So check that out. Google those terms, Fascia Research Society, and you'll see that there's an amazing opportunity to become part of a big membership. Robert, need to go. So thank you so much. Everyone at home, I hope you really enjoyed listening to Robert talk, and we're going to see you next time on Connect. Thanks so much. Bye-bye.
Thank you.